Hi, this is Bill Church, Executive Editor of the Herald-Tribune. Coming Sunday, always happy to have Barbara here who covers aging, but also oversees our wonderful health and fitness section. Barbara, you got another wonderful story coming this Sunday that will be of high interest for our readers.
I don't know if you remember this, but this story started with an email that a reader sent you claiming that Sarasota is a sort of epicenter for Parkinson's disease patients. I was not able to prove that. I looked at a lot of numbers and we don't have that evidence, but everyone I talked to said, yes, it's true. We have more services here, and also the wonderful weather and the cultural activities have drawn people who have Parkinson's disease and have the ability to decide where they want to live to this area. In this story, I profile a couple who came from Washington, D.C., and their story is a particular dramatic and sad one, and I think it'll give people insight into what it's like to have to change your life constantly in response to this progressive disease.
Now, Barbara, you've covered this topic many times and understand the services. As you went back into this story, were there aspects of it that surprised you?
Absolutely, because a couple of years ago, I wrote a story about the fact that there were all of a sudden two nonprofits in town who were both serving Parkinson's patients and raising money for the cause. And there was a lot of concern about, is this town big enough for the both of them? And the answer seems to be pretty clear that there's a kind of synergy going. They refer patients to each other, and they're working together well, and it seems to be a win-win for the community.
Now, are these organizations seeing an increase in number, or what are some of the takeaways that, as you looked at the services, made you think that maybe there is something going on here?
Well, they're building on each other, and as they're doing that, the science is progressing. So there are more and more treatments for these patients that are extending. They don't call it lifespan, they call it health span, the number of years you can lead a healthy life. They're also just starting to be, and the story addresses this, more resources for people at the end when the health span gives out and there needs to be pretty intensive care. There's a new business in town that is coming up with a care model that might work for them.
Right. So, read us this Sunday. Barbara's compelling story, always well written, always well reported. We have got an HT Preps Winter Sports All-Star section, and the Olympians are in town, and so you'll see that coverage. Of course, always go to heraldtribune.com for everything, including our connection to this thing called the Pulitzer that we've been talking about this week. Thank you for spending time with us.